Hi guys, Dr. Jade Rainbolt here, physical therapist, and today I'm going to show you how to improve your ankle range of motion, more specifically into dorsiflexion. Ankle dorsiflexion is whenever your ankle is going up like that. So plantar flexion's down, you're planting your foot into the ground. Dorsiflexion is going up. When you have a limitation in dorsiflexion, the motion of your ankle going up, it can affect the way that you squat, the way that you step down stairs, running, it can affect jumping and landing, even walking if it's limited enough. So it's really important that you have good ankle dorsiflexion to perform all these activities. Your motion can be limited from tight calves, tight muscles that run along the calf and the bottom of the foot. It can also be limited from the bones inside the foot not moving correctly or having abnormal movement patterns. So all the things that I'm going to cover today will cover a little bit of all of these. I'm going to go ahead and show you guys how to test if your ankle motion is limited, as well as how to improve it. First, I'm going to show you guys how to test your ankle dorsiflexion range of motion. So you're going to place your hand a hand's width away from the wall, and then put your foot right up against your hand, and then while keeping your heel down, don't let your foot cave in or your knee wobble, and then you're going to lean forward, try to touch your knee to the wall and back. So if you notice that your heel is coming up some, then that means that you have a limitation. So make sure you keep your heel down, don't let your foot cave in or your knee wobble. And I have a little bit of tightness actually on this side. So then I'm gonna look at the other side. And again, hands width, toe right to your hand, and then go forward. And it looks like mine is tighter on the left, which makes sense because I do have a little bit of ankle and foot pain. So I would benefit from these exercises. Again, moving forward like that. So a little bit of tightness, because if I want to go, my foot starts to come up. And that would be positive for a limitation. First thing you're going to do is grab your foam roller, and we're going to release the tissue. So you're going to put your calf on here, and you're going to roll out your calf. So it's a myofascial release of your calf. But you're going to run along the inside of your calf, the very top, and also on the outside of your calf. There are multiple heads to our gastroc, it's our calf muscle. So we're hitting a little bit of both of these. From there, I'm going to have you grab a band, and we're going to do a banded dorsiflexion mobilization. So you're going to have your involved foot in front, go into half kneeling, wrap that band along the very front of your ankle, and get a pretty tough band. And then you're going to place the other side underneath your knee. And then from here, you're going to lightly rock forward, keeping your big toe down. You don't want your arch to cave or your knee to wobble in or out. Keep it nice and aligned over your foot. And then go into more of a flexed position with your foot, and you're gonna rock forward and back. And this band is gonna help mobilize that talus bone behind posterior. And I would do about 10 of these. From there, you're gonna take the band away, and then you're gonna do a round without the band, and then just going forward. You may feel a little bit of a pull in the back of your ankle, but you don't want to feel pinching in the front. If you do, try some with the band again. Try rolling out a little bit more, because that pinching is the bones hitting each other, and you don't really want to promote that. But pulling in the back is fine. Next, you're going to go into standing, do a very similar mobilization as well, where you are slightly lunged forward and rocking forward into that dorsiflexion. Again, making sure your knee stays over your foot, not letting it cave in or out, and keeping those toes down, not letting your arch fall to the ground. And I would do about 10 reps. Okay. And then going from there, we're gonna go ahead and do a calf stretch. So there's multiple ways that you can do this. The first one can be bringing that foot to the back, making your foot face forward, and then keeping your knee straight, bending that front leg, feeling a pull in the back, holding for about 30 seconds. So that is part one. Or you can even do a calf stretch on the wall. I like this one because you control how far you push into it. But you're gonna put your foot on the wall, straight up and down like so, and then you're going to just lean into the wall. And you're gonna feel it pull through your calf like that as well. You can also do a dorsiflexion mob on the wall. So going into that calf stretch and then bending your knee forward, kind of like earlier when you were testing your calf, your ankle motion, except going in and out on the wall with your foot, with your toes on the wall. Again, going for about 10 reps. So for my squatters, anybody who is interested in squatting, you can also practice your dorsiflexion motion in the depths of a squat. So before you add a barbell or any weight, but you're going to go down into your squat and you can rest your hands on your knees, your elbows, and then rock back and forth. So again, that pushes that dorsiflexion motion while you're in that squat before you load up with weight. And again, rocking about 10 times back and forth. Okay, so now that we have performed all of the mobilizing exercises, I'm gonna retest my motion to see if it's improved. Again, so putting your hand down against the wall, toe right up against your hand, and then going forward. And it looks like it got a little better. So, good. Thank you guys for tuning in. I will see you in the next video.